Age-related macular degeneration is a medical condition which usually affects older adults that results in a loss of vision in the centre of the visual field, the macula, because of damage to the retina. It occurs in dry and wet forms. It's a major cause of visual impairment in older adults and can make it difficult or impossible to read or recognise faces, although enough peripheral vision remains to allow other activities of daily life. Although some macular dystrophies affecting younger individuals are sometimes referred to as macular degeneration, the term generally refers to age-related macular degeneration, commonly referred to as AMD. In this programme, we hear from the Royal National Institute of Blind People, better known as the RNIB, who offer information, support and advice to almost 2 million people with sight loss in the UK. Raising awareness of macular degeneration and its impact is a key part of the RNIB's work, as it is the leading cause of blindness. Leading consultant ophthalmologist Nicholas Lee and Ian Grierson, Professor of Ophthalmology at the University of Liverpool, discuss macular degeneration and a variety of other eye health conditions. We also hear from respected healthcare brand Bausch & Lomb, who offer the world's most comprehensive portfolio of eye health products. Bausch & Lomb's OcuVite Complete innovation is designed to provide nutrients which are thought to help maintain macular health and central vision. Finally, Steve Schallhorn, Chief Medical Director of Optical Express, explains why his organisation is the world's #1 provider of laser eye surgery. In the last 3 years, Optical Express has invested over £300 million in eye health technology and laser eye clinics.
RNIB, which is Royal National Institute of Blind People, is an organisation which provides information and support and advice to nearly 2 million people who've got serious sight problems in their lives. We've got 3 priorities. We work to stop people losing their sight unnecessarily. We obviously support people who've lost their sight, and we also work with the rest of society, with government and business and the community, to make the world a more inclusive place for blind and partially sighted people. The gateway for people who want to access their services is our helpline, and there we can offer support for people, advice for people to get back on with their lives if they've lost their sight. One of the most common forms of sight loss is age-related macular disease. And in fact, you don't go blind from age-related macular disease, but you lose a very significant part of your sight, and it can have a devastating effect on people's quality of life. But RNIB is here to help and actually help you get back on with your life, because there is life after AMD.
Age-related macular degeneration, or AMD as it's often called, affects a part of the retina at the back of the eye called the macula. This affects your central vision, your ability to see high-resolution detail, pictures, people's faces. Essentially, there are 2 types, the dry type of macular degeneration and the wet type. Dry AMD is the much more common type of AMD. It causes a slow, gradual deterioration in vision, and often people are not aware of any problems because it happens so slowly. There's no current active treatment for it. However, the importance of going for low vision assessments, the importance of using effective lighting and contrast is paramount to how somebody with AMD adapts to losing their central vision. The wet type of age-related macular degeneration is the much more drastic, sudden onset form of the disease. It has a rapid onset and can give people the impression of straight lines, door frames looking quite wavy and distorted. Treatment is available for this type of AMD, but it has to be sought very quickly. So we really advise people, if they notice any change in their vision, to go for immediate help. The 2 types of AMD both have similar effects on the function of somebody's vision. They both affect the central vision, where looking at people's faces or reading books or seeing high levels of detail become much more difficult, resulting in a central patch of vision that's missing.
AMD has a devastating effect on people's lives because when they lose that central vision, they can't drive anymore. Cooking and getting about becomes a real problem. Reading and watching television and just enjoying your family become real problems. And that has a deep psychological effect. It can be devastating for people. But RNIB, one of the things we want to do is to help people get back on with their life. There is life after AMD, and with help and support you can carry on with your life.
Currently, the exact cause of AMD is not known. However, there are some risk factors which are clearly well established. Smoking has been highly associated with AMD. In fact, smoking doubles your risk of developing the wet type of age-related macular degeneration. Additionally, smoking and developing AMD has been found to be just as strong a link as between smoking and developing lung cancer. Eating a healthy, balanced diet is really important to protecting your eyes. Lots of fresh fruit, vegetables, green vegetables, things like spinach, kale, broccoli, all got high levels of antioxidants that protect your eyes against the effects of age-related macular degeneration. Ultraviolet radiation has also been associated with developing age-related macular degeneration. So protecting your eyes in bright sunlight is really important. Wearing sunglasses and wearing brimmed hats will protect your eyes from the effects of high levels of radiation. Age-related macular degeneration has also been associated with the same risk factors as cardiovascular disease, so protecting your eyes will also protect your overall health. However, as the causes of AMD are not currently known, you might still develop age-related macular degeneration despite looking after all of these considerations.
I haven't found that it's stopped my life. I still do quite a lot of things that I could do in the past. I go swimming, for instance, which is a great big thing with me. I've always adored swimming. I'm 97 and I can still get on with life because I can see a lot. Actually, I know a lot of people with macular degeneration are much less lucky than me. I go to Moorfields all the time and I've been injected a lot, but now they've sort of signed me off and they say that it probably won't get any better. But you don't, of course, ever go completely blind with macular degeneration. And I've sat next to people in Moorfields who are aged 30-something and they've got it. And I think really I'm so lucky to have lived all this time. And I can see scenery and things like that. And I can do the garden. And I have found that the RNIB does provide help for things. For instance, if I get a script, of course, I've got to do an audition. Well, possibly. Sometimes I'm so famous that they have me without an audition. but if you've got an audition, well, of course, I can't do that because you have to read like that. But I've got a scanner, and I got that from the RNIB, and it's like that thing behind me, and you can blow it up big, and then you look at it down there, and you can blow it up big, and that's wonderful. So that when I get an audition, I say, send me the script, and I'll learn it. And I learn it on my scanner, and so I can go and act it properly when I go to the audition. So, yeah, certain things do help enormously.
Your GP is an absolutely vital gateway to treatment, as well as referring you to the eye doctor at the hospital, that's the ophthalmologist, where you can get treatment if that's possible. He can also refer you for a low vision assessment. RNIB believes it's vital that people have a low vision assessment, particularly when their sight is stabilised, because a low vision assessment will help you find ways of getting back on with life, getting on with reading, getting magnification, getting other help to do those everyday tasks that you want to do to get on with your life. And also, there are other things like self-help organisations, the Macular Disease Society, RNIB's partner, Action for Blind People, run centres across the country that can help you find equipment and other things. And there are great services for people, but lots of people just miss out. They go home and just think that that's the end of their life. And actually we really need to encourage people to go to their GP, and we need to encourage GPs to not just think about the eye doctor, but also to think about those other services across the country which support people to get back on with life.
The treatment involves a series of injections into the eye. This type of anti-VEGF treatment, now available on the NHS, is designed to stop the growth of new blood vessels from forming. This new type of treatment stabilises the vision in most cases. Some people even notice an improvement in about a third of the cases. For the dry type of AMD, there's no active treatment. However, research has shown that vitamins A, C and E, zinc and copper in high doses can slow the progression of AMD. It's really important to have a diet that's very rich in green leafy vegetables that contain these vitamins. Vegetables such as spinach, broccoli, red peppers can all improve your diet to prevent the progression of dry AMD.
One of the vital pieces of the GP's toolbox is RNIB's helpline. The helpline is a gateway both for the GP asking for advice, but also for individuals to get access to support services. Great things like RNIB's Talking Book service, emotional support services, practical products that enable you to get on with cooking and reading and using your telephone and all those other everyday things. So the helpline is a great way of accessing those and also accessing local organisations around who can help you. RNIB leads something called the UK Vision Strategy, which is a partnership with ophthalmologists, that's the eye doctors, optometrists and nurses and GPs and the government and lots of other organisations to promote eye health. And we do that both nationally, but also we encourage every region and every part of the country to have a local vision strategy project to improve eye health. So we do that, and through that we do things like the eye conditions leaflets. So these are leaflets that are available from RNIB and published in conjunction with the Royal College of Ophthalmologists to provide the very best advice and information on each of the eye conditions, including AMD, age-related macular disease. And then make sure that we've got really good information. And then we do practical things, like we enable a GP to write to somebody in large print or in braille or in audio. That's our web doc service, which we offer to GPs and to other organisations.
If you've got any concerns about your vision or about AMD, go and speak to your optometrist or your GP. Visiting the RNIB website or calling our helpline will also give you important advice and an opportunity to talk about your concerns about your eyes and about AMD. We also provide information for health professionals. We're here to support any questions you might have about your patients. If a patient comes into you to talk about any concerns they have about their eyes, you'll find that our helpline and our website will provide information about age-related macular degeneration and a whole host of other eye conditions as well. We are regularly reviewing our website with information from NHS evidence and various other sources to ensure that it is up to date. If you do experience AMD, blurring to your vision and difficulty seeing faces, reading, once you've had your low vision assessment, the most important thing to remember in your home and when you're out and about is to ensure you have your objects to see bigger, brighter and bolder so that you can navigate and move around comfortably, easily and see what you need to see.
RNIB's helpline is a great source of information and support to get back on with your life. And our website is full of information and practical services to enable you to get on. RNIB is there to help you get on with life because there is life after sight loss. And don't give up on your sight. It isn't part of ageing. There is life after AMD.
Macular degeneration is a very common condition that affects people from the age of 60 onwards, affects anything up to 1.5 million people in the country. The interest now is that there are things that we can do to pick the disease up early, reduce its effect, and actually treat some of the more advanced forms of the disease. Drusen are small yellow bodies that the eye doctor or the optometrist will see at the back of the eye. They form usually after the age of 60. They don't tend to increase in number and are part of the early macular degeneration. There are two types of macular degeneration, the dry type and the wet type. Dry macular degeneration can be divided into early forms, intermediate and advanced forms. It starts off with just perhaps a few drusen, a little bit of thinning of the retina, vision may be hardly affected. It can then progress on over the years to be a little bit more advanced, vision becomes a little bit more patchy, maybe when reading a little letter or two is missed, and then onto the more advanced forms in some people where the vision can be quite significantly affected, even to the extent that you might need to be registered as partially sighted.
I was really close to my mum and my dad actually. They both passed away in 1999, but I obviously still, think of them all the time. I have very fond memories. When my mum was diagnosed with AMD, I didn't know what it was, but obviously you find out about these things very quickly, we all did. And I was really shocked to learn that it's actually the most common cause of blindness in the UK and in the Western world. And then another shock was to find that dry AMD, which is the most common form, is also untreatable.
The commonest form of macular degeneration, which accounts for 90% of macular degeneration, is the dry form. It can change into the wet form. The symptoms of dry macular degeneration, remember that it affects the macula, which is the very centre of your vision. So if you have macular degeneration, it tends to cause blurring in the centre of the vision. That's different from wet macular degeneration, which patients tell me time and time again that the vision actually becomes distorted, straight lines become wobbly.
The greatest risk for AMD is age, but also nutrition. Poor nutrition, poor diet, a diet low in fruit and vegetables is also a risk factor.
When my mum was diagnosed with AMD, she stepped up her intake of leafy vegetables. Had I known about Preservision at that time, or had she known, she'd have certainly taken that.
The other risk factors include, well, probably the worst one is smoking. If you can stop smoking, that's really very good.
Luckily, I've never smoked, so smoking and AMD have been linked in some studies. What I also do, though, is I take a supplement. I take Ocuvite, which is made by Bausch & Lomb, and that's really good because, to be perfectly honest, you have to eat kind of Popeye-sized portions of spinach. It affects women more, especially blonde-haired, fair-haired, blue-eyed women. I can't do anything about that or my age, but what I can do is guard against environmental factors. Sunshine, I don't smoke, lots of vegetables and regular eye tests.
Wet AMD is treated primarily by injections, and these are injections into the eye, and they are repeated on occasion. They need to be done several times. But they can make a dramatic difference to the outcome. The second form of treatment that's used involves laser treatment.
My grandmother was diagnosed with AMD a few years before she died, and it was quite a shock really. I was away filming at the time, and so hadn't really known about the build up towards it or about her sight deteriorating, anything other than your sight naturally deteriorates as you get older. My grandmother described it as a black hole in her vision, and it wasn't really until I started to research it a little bit more that I understood a little bit more what the condition involved, how it affected her, and the fact that it was also could be hereditary. When I was 16, I started a new school, started my A-levels, and I couldn't see the blackboard anymore. So ever since then, I've been aware of my eyesight. Even things like my job, when I'm filming off in sunny, exotic locations, which is wonderful, there are so many risks associated with that. Everyone thinks, oh, you have to protect your skin in the sun, but not many people will think about protecting their eyes in the sun. You can help to prevent AMD developing through diet and nutrition. Lots of people take vitamin supplements and all kinds of supplements for different things, but I had no idea that there were supplements available out there that could actually help with your eye health.
It's very important to have an evidence base for our medicine, and AREDS was a huge study. It's the age-related eye disease study funded by the National Institute in America, and it looked at antioxidant vitamins and also minerals like zinc, and asked the question, would this supplementation delay age-related macular degeneration? And it found in a fairly positive manner that that was the case. The people who should take the AREDS formulation are people who have intermediate disease in both eyes or who have severe disease in one eye. There is no treatment as such for dry AMD, but in the early stages of the disease, if you have good diet or use supplements, that can make a difference to the development of the disease process.
Optical Express is the largest provider of laser vision surgery in the world today. It comprises a large group of clinics, of surgical centers around the UK. In fact, it employs over 2,500 personnel. We have and employ the best surgeons. Our surgeons have a phenomenal experience. They have collectively done over 700,000 procedures. So their experience is vast. In addition, we use the best technology that's available today. The best laser vision surgery technology and the best equipment. We also have an international medical advisor board comprised of world-renowned leaders in the field internationally. And they provide clinical diligence, they provide oversight to everything we do to ensure that we do everything proper and as best we possibly can. So what is Optical Express? Optical Express is a company that provides state-of-the-art laser vision surgery to give every patient the best kind of procedure that we possibly can. Laser eye surgery encompasses several different techniques to reduce dependence on glasses or contact lenses. As such, it's really a life-changing procedure. It reduces dependence on glasses or contact lenses, the dependence on these functional things that we have to wear when we wear glasses. It is really the foundation of the technology is a laser, a cold laser that gently sculpts the cornea under computer control, which again corrects the refractive error. There's really two different types of procedures. One's called LASIK and the other's called LASEK. They're both very similar. In the LASIK procedure, the laser is used to sculpt the cornea under a flap, which is made with another very special laser itself. This is the procedure that millions of people around the world have performed. In fact, it is the most common elective procedure in the world today. The LASEK procedure is very similar. It's done on the surface without a flap, and it generally can have a little more discomfort for the patient after surgery. But both procedures are relatively pain-free. The LASEK procedure is a procedure that's performed very similar to LASIK. And we, at Optical Express, when patients come in, we select the right procedure for them. The LASEK procedure, just like the LASIK procedure, is very safe and very effective. And we make sure that the patients are properly selected, that they know the procedure itself, and that we give them the best care possible. Optical Express uses the best, most state-of-the-art technology in its laser eye surgery. And it's really founded on two important technologies. One is the technology that is used to correct the error of refraction, to correct the need for glasses or contact lenses. The procedure is called wavefront guided, and we use the pinnacle of wavefront guided technology called advanced custom view. In this technology, we map the eye in great detail, and then we apply all of that precise detail to the treatment itself under the excimer laser. So this this soft, gentle excimer laser corrects those refractive errors based on this wavefront guided technology of advanced custom view. The second aspect of the technology that we use is a special laser to create the LASIK flap with. It's the intralaser, and we use the best intralaser technology called the IFS. This IFS laser has incredible and best precision, accuracy, and safety of any lasers that are available today. The combination of these two technologies, advanced custom view and the IFS, represent the best, most state-of-the-art technology that's available today. And that's what Optical Express uses in all of its centers. It's also important to appreciate that this same technology that Optical Express uses is what led NASA to approve LASIK for astronauts.
Prior to having surgery, I sort of spent the last 6 years from when I was at university struggling with my vision. I'd sit right in the front of the class, and even then it would be a struggle to see the screen. So it was definitely something that I always wanted to get done, but was apprehensive about just taking that decision to finally do it. So it was definitely something that I did want to do beforehand. It was definitely the right decision for me to make. I don't need to wear glasses, I don't need to worry about lenses. I can actually see clearly without squinting, and I can see the clock when I wake up in the morning.
Laser eye surgery improves vision and can give you complete freedom from glasses and contact lenses. It is a positive and life-changing experience which can improve many aspects of everyday life. Just imagine waking up in the morning and being able to see your alarm clock without any glasses. No need to fumble around for glasses. If you're a new parent, waking up in the middle of the night to check on your child. If you lead a hectic life, which most people do, or if you participate in many sports, you don't need to worry about losing a contact lens or breaking any spectacles. Many of our patients that have had laser treatment tell us that it minimises the hassle of packing while going abroad. So forgetting their prescription sunglasses, the contact lenses, contact lens solutions. So just in terms of being really spontaneous, dipping into a pool, not worrying about if sand gets into your eyes, sunscreen gets into your eyes, it just makes your everyday life so much more simple and easy. Many patients say, why haven't they had laser eye treatment done earlier, years ago? And you know, there's no way to find out unless you have a consultation to find out if you are suitable. So at Optical Express it is free. Have a consultation and find out if you can get it done.
Optical Express is the largest provider of laser vision surgery in the world today. It has invested over £300 million in the best, most state-of-the-art technology, in the best people that work for Optical Express, in the best clinics. As such, it's pretty easy to imagine that we provide the best procedure possible, the safest, most effective surgery to give the best possible care to the patients that come in to have surgery.
As we've seen, the treatment for macular degeneration and other eye health conditions has changed rapidly over the past few years, and new potential treatments continue to be developed and tested. Having an eye test at least once every 2 years should be part of everyone's healthcare routine and should be actively encouraged by healthcare professionals. However, it's important to remember that many causes of sight loss are preventable if they're caught early by visiting an optician. I'm Georgina Burnett and you've been watching NHS Insights, Macular Degeneration.